because the Trump administration didn't publish reliable COVID data, other people tried to pick up the slack. Groups like the COVID Tracking Project, which did phenomenal public-facing work throughout the pandemic, they closed up shop yesterday, I think in part in the expectation that you're going to be able to pick up the slack and that once again, CDC will become the authoritative, definitive source of data about the epidemic, not just for practitioners and experts, but also for the general public, because so many of us want to be tracking these things day to day. I mean, to be frank, as of right now, none of that information, hospitalization numbers, new case numbers, death numbers, vaccination numbers, none of that information is easy to find or well presented on the CDC's website right now, even as other people who are good in this space are leaving so that you can take up that room. What are the plans that you've got to improve that so the general public can go to CDC again to get the best data on this pandemic?
Data monetization has been a huge effort with the CDC. This is something we are actively working on. We are relying on data from all states and territories and tribes to compile all of those data. The infrastructure and data was really thin, has really been pretty frail for the last many years, not just during COVID. And so we are actively working to ensure that we have more electronic case reporting, more laboratory reporting, and more reporting from all of these states. It's an active area of work, and I really am looking forward to resources from the American Rescue Plan to help facilitate that.
Interesting. Are there other things that are going to be newly possible for CDC because of the COVID relief bill, because of the American Rescue Plan, that haven't been possible until now? Obviously, there's a big chunk of this plan that is, of this bill that is targeted to try to improve the COVID response, not just rolling out vaccine, but everything else. What's in that bill that's going to make your job easier and make the CDC more capable?
There are so many components of that bill, from vaccine rollout, vaccine education, engagement, testing. There are many things that are components of the American Rescue Plan that we will deeply rely on in the months and year ahead. I will say that the public health infrastructure of this country has really suffered over the last decade. 56,000 jobs have been lost in public health in the last decade, 180 in this last year alone. If we are going to build a public health infrastructure that is able to tackle issues such as H1N1 influenza, Ebola, Zika, we've all seen them in the last year as the public health infrastructure has been frail, and COVID-19. We need a public health infrastructure. We need resources to pay for the workforce. We need laboratories. We need epidemiologists. And all of that is, I'm looking forward to, and data monetization, as you noted, all of that I'm looking forward to in the years ahead.
Thank you.
Thank you.
Thank you.
Thank you very much.
Thank all of you out there.
Thank you as always.
Thanks to you at home.
Thanks for watching.
Thank you so much for letting us into your homes during these extraordinary times.